Hello everyone, my name is Autumn Cleary and I'm going to be presenting on the M-Paci, that's the Millon Pre-Adolescent Clinical Survey. So we have a little bit here on the history, the background, the origin. It was created by Dr. Theodore Millon. He was a leader in the field of personality and he was a developmental theorist. He actually taught at Harvard and University of Miami. He wrote many books. He helped co-author additional psychiatric tests, and he fashioned a lot of other tests on personality for adolescents as well. So the origin, he originally designed the test to identify psychological problems in children. He provided an integrated view that identifies emerging personality. Emerging is important because this test is only available for ages 9 to 12. It would indicate emerging personality types. So it helps detect early signs of Axis 1 and Axis 2 disorders. Axis 1 and Axis 2 are terms that are no longer used. These are terms that were in the DSM-5. The DSM-3. Axis 2 disorders are personality and developmental disorders, with all other disorders being Axis 1. The length of the test and the number of questions, it is under 100 questions. It's 97 true or false, and for an adolescent, it takes about 25-30 minutes to complete. The current purpose, like we discussed before, is to evaluate troubled pre-adolescent teens and to confirm diagnostic hypotheses. There are a couple competing tests. I do list on the bottom the M-Paci. We've done a lot of things with the M-Paci. The A indicates adolescent, and so I didn't really go into depth about the M-Paci. What I did go into depth for is the competitor, the M-Paci, which is also developed by Millon, and it's the Millon Adolescent Clinical Inventory. Some of the strengths, it is a little bit older. For the older group, it's 13 to 19, and it has good reliability, but only for short periods of time. Some of the weaknesses, because it is for a larger age group, it is 160 true and false questions. Does take a little longer to administer, so it takes about 25 to 30 minutes. As far as the M-Paci goes, the strength of it was that it only requires a 3rd grade reading level, which should be more than adequate for a child who is 9 to 12 years old. It is useful in many settings, so like inpatient treatment, outpatient treatment, day treatment, residential treatment, the key word there being treatment, and we'll talk about that in just a minute. The weakness, like I said, it is only for children ages 9 to 12. So how do you use the M-Paci? It's used in, like I said, many different settings. We have the school setting in which the school psychologist would administer. Does take a level C qualification to administer, so it does take a lot of training. Psychiatrists, other mental health professionals would use this in an array of different settings. I'm not going to repeat them. And it is a great measure for pre-treatment, during treatment, and after treatment. It contributes to individualized treatment plans, providing an integrated picture of emerging patterns of personality. It also is a good tool to discern whether early intervention is needed and what type of early intervention is needed. It identifies the emerging personality styles of emotional instability, oppositional unruliness, and sensitive inhibitions, and it addresses clinical issues, and this is why it said more of an integrated approach. So it does identify problems such as ADHD, depression, anxiety, conduct disorder, and reality distortions in teens and preteens. So some of the scoring and scales Like I said, it does have 97 true-false questions. The scoring, it includes a summary of the potential treatment strategies tailored to each test taker. There is a web-based program that offers this for you, and it generates a report, which is really awesome. I do have a sample report that we can take a look at here in just a minute. The 7 emerging personality patterns that it identifies are confident, outgoing, conforming, submissive, inhibited, unruly, and unstable. And the 7 clinical signs would be anxiety, fears, attention deficits, like with the ADHD, obsessive compulsive, conduct problems, disruptive behaviors, depressive mood, and again, we have the reality distortion. It has 2 response validity indicators, which would be invalid or RN, which is response negativity. So the really awesome thing about this test, the M-Paci, is it does have a good validity and oh my gosh, I'm spacing the word. Anyway, the norm of this population for the M-Paci consisted of 292 pre-adolescents, age ranges 9 to 12, which makes it valid and reliable, and then it was taken from 53 sites among the U.S., so I do believe that it has a good representative of the norm population in which it wants to test. It is based on up-to-date national norms in children in a variety of settings, so such as court, school, psychiatric evaluations, residential treatment programs, and other settings. So it is a good representative norm, which leads to the reliability and validity. That's the word I was looking for. Thank you. And here we have a sample of the results. I included a link in here. So if you want to take a look at that, it is really cool. Just has a report on the different clinical findings and the different scores and scales that we went over. And then it does talk about at the end, like the MMPI does, it talks about the different questions that would indicate trouble in the report. So I thought that was pretty cool that you can go back and look on which questions led to the concern. So as it does use this test for treatment, as with all tests, it's just a guide. It's to be used with a grain of salt, and maybe use just your own questioning and judgment to move forward in treatment and things like that. So the question that I have, the main purpose of the M-Paci is to evaluate troubled adolescents, which we talked about, with the intentions of doing what? What does it do? A, treatment and interventions. B, assessment and referrals. C, diagnosis and imprisoning. Or D, none of the above. And we said A. It does. It does treatment and interventions, and it's used as a tool in aiding in both of those processes. So these are my references. And thank you very much for watching about the M-Paci. Have a wonderful day.